Now, what we know is that body mass index has been around for approximately 200 years. And originally was the idea of a Belgian statistician who came up with this concept really to look at individuals. But the idea of looking at these individuals was not really to classify them as being obese or look at weight distribution or what the actual mass was made of, but it was to look at individuals who had what we would call an average body composition. And the key thing here is really that what body mass index looks at is the mass of an individual. It doesn't take into consideration what that mass is made of, whether it's fat or whether it's lean tissue. And what we know now in medicine is that it's the body composition which potentially is more important than the actual mass. Now, unfortunately, what's happened over time is that the medical profession have become overly reliant on this issue of body mass index, and not just the medical profession. Insurance companies, for example, will base your premiums depending on your body mass index. Now, that may be appropriate for some individuals, but certainly if we give you extreme examples, for example, someone who has a very athletic build and has a very large amount of lean muscle tissue, it's clearly not fair that these individuals should be paying more for their premiums, and clearly they are not at increased risk of metabolic problems. And by metabolic problems, I'm talking about increased risk of diabetes, increased risk of high blood pressure, and problems with your lipids. Now, all of these will ultimately increase what we call your cardiovascular risk, and that's your risk of developing strokes and heart attacks in the future. As I've already mentioned, body mass index takes into consideration simply the mass. What it doesn't do is it doesn't actually look at ethnic groups, and we know that different ethnic groups have different body composition and different body composition distribution as well. It doesn't take into consideration age, and what we also know is that as you get older, or the amount of lean tissue that you have gradually decreases, whereas the amount of fat tissue increases. And it certainly doesn't take into consideration gender, and I'm not saying women are fatter than men, but clearly there is an alteration in body composition with women tending to have a greater degree of body fat. So, as I've mentioned, my involvement was somewhere in the region of about 5 years ago when Richard initially approached me to do a weight management trial, but since then things have progressed, and what we've looked at is the volume software and developed the volume software. I went across to the Mayo Clinic in about 2007, and we've now running some collaboration studies with them. You may have seen one of the posters that we published jointly with the Mayo from one of our pilot studies. I've also been involved with discussions with the retail industry, so Marks and Spencer's, Next, etc., because they actually have one of the largest databases of individuals with these 3D body scans, and the idea is to try and get this information from them so that we can actually develop what we call a normative database to try and help us to progress the body volume scanning. And then clearly what we're looking at is more research and validation, because clearly the studies so far have been pilot studies which are ongoing. And this is one of the reasons why we got the Mayo Clinic involved. In 2006 they published a paper in the Lancet. I'm sure you're aware the Lancet is a very reputable journal, and what they suggested was that BMI lacked discriminatory power when it came to assessing individuals for cardiovascular events. And again, by cardiovascular events I want you to think about patients who are at increased risk of heart attacks and strokes. And what they suggested was that body shape and potentially waist circumference were more important. And in fact, there was another paper published in the Lancet which did demonstrate that waist circumference was more likely to be associated with increased risk of heart attacks.